I'm really excited about the way the global engagement programs are helping Rivier students prepare for careers. We've seen it already, the impact it can have. One of our students, a fantastic student, but has a tremendous global capacity, has traveled to India, has traveled to Africa, and was recently accepted at Brown University for a graduate program. And I really believe, and she also believes, that part of her acceptance was because she has a global perspective and global experience. It's a way to distinguish our students in a very unique way, in a very important way, from all the other students who are out there, that they have a global understanding of things. Our nursing faculty have been on top of this from the very beginning, and as our country continues to diversify, and even in the state of New Hampshire, which many would perceive to be kind of monocultural, and it's just not. We're one of the major sites for refugee relocation by the United States government. And so we have a large Bhutanese community. We have communities from all over the world who are now residing both in Manchester and Nashville, which means our nursing students, when they work in those hospitals, have to understand not just how to engage local people from Nashua, but also how to engage a Bhutanese person who's walking into an American hospital maybe for the first time. So having a global experience, having a global perspective, that be language or a course or an actual trip, has allowed them both to be able to service really well in the hospitals, but also it distinguishes them in a resume, because that's something that employers are looking for. They want to see students who aren't just from here, but who can think much more broadly. And I think global engagement is really helping them do that.
Anything that's going to cause a student to reflect on what they bring to the table, to reflect on their own culture, to reflect on what another person's perspective is very important. I think that sometimes we get very caught up into our own, this is how I see things, this is how I do this, and this type of experience does make them aware of who they are, what their own culture is, how that affects, how that might affect someone else, and then also if they're, not just as a nurse, but anywhere in life, that trying to understand somebody for who they are, I think these are invaluable experiences.
Experiences like this clinical immersion, are very important for nursing students because our world is shrinking. We are caring, as nurses, we are caring more and more for patients from diverse cultural backgrounds. And we must be culturally competent to care for these individuals. And an experience like this takes them out of their comfort zone, puts them into a natural environment for their patient to see what kind of a culture that they come from, and that kind of helps them, gives them a perspective when they're providing nursing care here. Also, we have to be able to work within a global workforce. We have to be competitive. So caring for patients from diverse cultures, plus being competitive in this global workforce environment, I think is very important for any nurse. There are many employers that are looking to see that students have gotten that experience. So they want to see it on their resume. They want to see that they've come out of their comfort zone, that they just didn't have a clinical experience locally or regionally in the hospitals that surround them, that they want to know that they're pushing the boundaries, that they are looking to see what else is out there in terms of healthcare systems. So employers are looking for that. They're demanding it.